can treat a herniated disc. Herniated discs are most likely to happen in your low back or up in your neck. A disc is the support in between each of your vertebrae so that you have the space for the spinal cord nerve that comes off and branches to come out. So that disc has that or provides that support. A disc is like a jelly donut. So it's a little firmer around the outside, and then on the inside there's that jelly. As we age or if we have an injury, we can have a little weak spot in that disc, and then it leaks out that jelly. That jelly can come out, put pressure onto your spinal cord or onto those little nerves that branch off of the spinal cord. So your neck has to do with the upper extremity motion and feeling, and your low back has to do with the feeling or pain down into the legs. If you herniate a disc, 9 times out of 10, they will heal either on their own or with a little bit of supportive therapy. So it's that 1 out of 10 times that will require surgery. If you injure your back or your neck, and it could be disc related, you'll normally have pain, a pretty intense pain. You'll have maybe some numbness and tingling down into your extremity, or a burning sensation, or an electric shock type pain. Sometimes it will even cause muscle weakness where you can't utilize that arm or you can't utilize that leg. You can also get some sciatic pain, pain in that hip that runs down the leg, back pain. It can lead to all sorts of different things. Also, it can cause urinary issues, so a urinary incontinence or even a bowel incontinence. If you have something as severe as that, that definitely needs to be addressed with your physician, and the sooner the better, because that means something is really being impinged and you need to address that more than likely surgically. Causes of a herniated disc can be just degenerative changes as in aging. It can be a traumatic injury. It can also be hereditary, which you have osteoarthritis of your spine and that has been passed on to you. It can also be from repetitive bending or repetitive twisting activities, and also too heavy lifting. So some risk factors for a herniated disc are being between the ages of 30 to 50. Men are twice as likely as women to have a herniated disc. Also, if you sit for extended periods or drive for extended periods, that puts a lot of pressure on that back and it makes you more likely to herniate a disc. Some prevention ideas would be maintain really good posture. Shoulders up, core tall. Also, when you bend, make sure we don't bend at our back. We should always bend at our knees to lift something up. So that good lifting technique is very important. And also try not to grab something over here and lift it up and twist. You want to position your body. You pick up an item and then you turn your body once you stand. That gives that core some really good support and you're not putting that pressure on your back. So stretching is also extremely important, because if we have tight muscles, and of course over time we get that rounded posture. We kind of get the rounded shoulders, the flexed back, the flexed shoulders, and you need to really stretch opening up those joints, keeping the muscles that try to tighten up nice and lengthened is important. If you don't have a strong core, then our back is at risk for injury. So one more thing is, if you can, avoid wearing high-heeled shoes. When you see me in position with my tennis shoes on, you can see I'm in a good posture. But as soon as I lift my heels up, my hips shift forward, there is more of an arch to my low back. That puts a lot of pressure in that low back. And if you're standing for long periods in heels, that causes a misalignment for that period while you're wearing the heels, which puts you at an increased risk of hurting your back. So some home treatments or some home remedies for injuring your back or a possible disc herniation are, you want to take care of yourself and you need to rest. Also, you can alternate heat and ice. Heat is going to increase the blood flow to help with the healing process because you want that good blood flow coming in. That ice is going to decrease any swelling, and it's also going to push that bad blood flow out. So it kind of works as a contrast. So you increase the good blood flow and you push the old blood flow out. In addition to, if you're having any type of a spasm in your back, that heat is going to help with that. You can also take over-the-counter anti-inflammatories such as Advil, ibuprofen, Aleve, whatever you prefer to use. Normally, a disc will resolve on its own. It'll scar back over and it will resolve on its own in 4 to 6 weeks. If it does not, if your pain becomes too intense, if you have a lot of numbness, decreased use in your arm or in your leg, or if you have any bowel and bladder issues at all, you should definitely see your physician. You could be a candidate for a surgical procedure. More supportive therapies would be physical therapy, where we could educate in stretching the muscles that need stretched, strengthening the muscles that need to become stronger, also in stretching activities to take the pressure off of that disc. Chiropractic care is very good just by doing some traction stretching, some traction techniques. It takes the pressure off the nerves, which then again help to decrease your pain and increase your function. Acupuncture can be very, very beneficial, and also a massage, a deep tissue massage where you might be having some spasming or some guarding in that area, that can really help. What I'd like to go over now is some exercises to help encourage healing from a herniated disc. So we'll start with the neck. The first exercise would be a chin tuck, which is pretty much like setting your chin on a little table and you pull straight back. I always say if you can give yourself a double chin, that is good positioning for that chin tuck. So from the side, it's just like you set your chin on a little table and you tuck that chin back and release, tuck that chin back and release. So 3 to 5 seconds, you should hold each of those, and 15 to 30 reps. You could do 3 sets of 10 during the day just to start increasing that function. So another activity would be just shoulder rolls forward and shoulder rolls backward, opening up, palms are front. This is a little external rotation up in those shoulders. 30 repetitions, I would do that twice a day. And you can do some isometrics. So you're going to use your hand as your resistance. And I'm going to turn to the side for this one. So you can try to push your head forward, try to pull your head backwards. So you're just going to use your hand as that resistance, and you're going to push. 3, 2, 1, release. 3, 2, 1, release. Same thing for the extension. You can try to take that head back and hold. 3, 2, 1, release. Another range that we have is that ear to shoulder, that lateral flexion. So use that hand, resist, resist, and we always do it bilaterally. So we always do it on that opposite side. And then the other that we have is that rotation. So we hold the hand and we try to rotate the head into that hand, providing that rotation resistance. And then to the other side as we try to turn our head and we provide that resistance. This is providing an isometric contraction, just that contracting and holding. And this is very good for building that stability back in the neck. Exercises for your lumbar or your low back if you are having trouble with a disc. A great exercise is to decompress or elongate that spine. Now you can get an inversion table where you hang from your feet and you decompress that way. You can also grab up onto a bar and hang, or you can just push your arms up overhead, really stretch up. Try to relax your traps so that you're not lifting those shoulders up, and just reach to the ceiling, really elongating that spine. And this is a great stretch to just open up the vertebrae in your back. You could do a mid-back stretch. So you would just take it down onto your knees, hips onto your heels, and you would walk your hands out and keep stretching and walking out a mid-back stretch. Another great exercise would be a cat-cow stretch. So you're on your hands and knees, you round up your back and you tuck in your chin, nice deep breath in, and you blow it out into the cow. The belly comes down towards the floor and that chin comes up. And just alternating back and forth, each time trying to get a little bit more range of motion. Another very good exercise to help with resetting your disc, prone press-ups. So you just push up through those elbows, lift, hold, 3 to 5 seconds, and release. Once these become a little bit easy, you can place your hands underneath the shoulders and you can push up a little bit further into that extension of the back. Another very good stretch is a single knee to chest. You're just going to bring your knee into the chest and you're going to hold. I would try to hold 30 to 60 seconds and then alternate. Switch to the opposite. When this one becomes easy, we could increase this stretch to both knees and hold. Another problem area would be that piriformis muscle. So how to stretch that piriformis muscle? When we're in this lying down position with our knees bent, we would cross one ankle over the knee and we would reach through and grasp that knee. Just holding stretching, and of course we would switch after that 30 to 60 seconds. Pull in and hold. We could also sit with our legs out. We could cross that foot and push down on that knee to hold that stretch. You can also do this sitting in a chair and always switching. 3 reps each side and holding for that 30 to 60. One last stretch is a hamstring stretch. Sit up nice and tall, legs out, and you're just going to reach for the toes. So a common mistake with your hamstring stretch is where everyone thinks they need to get their chest down onto their knees. That is very hard in your back. So you just slide or walk your hands out and you reach for those toes, keeping that back nice and straight. A couple strengthening exercises that are very beneficial. One would be a pelvic tilt, in which we just pull the navel into the spine, round up the hips, and release. So we round out that low back, lift up the hips slightly, and release. Also, that bridging activity, navel into the spine, we push through the heels, lift the hips, and lower. And again, lift your hips and lower. Hopefully this has provided you with a little bit of education, and hopefully this has given you some ideas for some exercises that might help.